Today, we are going to show you how to fill out this form. Step 1. Place label here. Put in the patient label or sticker. Step 2. Date. Fill out the date. Make sure the month comes first. Then the date, for example, August 16, 2022. Step 3. Area. Be sure to write the patient area or the room where the patient is located when filling out the form. For example, Emergency Center Cora Room 2 equals ECA2. Step 4. Cards. If the patient has a debit or credit card, be sure to check the type of card. Please mention if it's a Master or Visa, or Amex in the type of card. And how many cards they have, for example, 3 Visa cards, 4 MasterCards. If the patient doesn't come with no cards, just write, not applicable. Step 5. Social Security. If the patient comes with any Social Security card, you would write in the number of Social Security cards they came in with. If they don't come with anything, write in not applicable. Step 6. ID or license. If the patient has any form of ID or license, for example, if the patient comes in with a California driver's license or ID, you write the number of driver's license as 1 California driver's license with number 409074443 or 1 California state ID with ID number 409074443. Step 7. Electronics, cell phone. This is a very important part of filling the belongings sheet. For example, if the patient comes in with 2 red and black phones, one is cracked and the other is not, then you have to write down the description of the phones as 1 cracked red cell phone and 1 uncracked black cell phone. Step 8. Electronics, laptop. If a patient comes in with a laptop, make sure you put a label on the laptop and secure the laptop carefully in a patient's clear belongings bag. Make sure you check the laptop to see if there is any crack or any damage. If the screen is damaged, you can write, 1 cracked screen HP laptop. Step 9. Electronics, tablet. If a patient comes in with a tablet, be sure you inspect the tablet properly to make sure there are no cracks. Then you can document it as 1 yellow cracked laptop, if any crack available. Step 10. Jewelry. Make sure you properly check out the type of jewelry, if it's gold or silver color jewelry. For example, gold color jewelry would be a yellow color ring or yellow color earring. If it's a silver earring, just document or write as a silver color earring or ring. Step 11. Money. Make sure you count all the money the patient comes to the hospital with. For example, if they come in with $100 in $20 bills and coins, make sure you write the amount in bills and in coins. Step 12. Money, Part 2. If a psych patient comes into the emergency center with more than $100, please make sure you get a nurse as a witness and make sure you both count all the money together. Then document and make sure they sign. Step 13. For psychiatric area use only. Use this part for itemizing all patients' belongings. Everything you write here has to be in words, and that would be the summary of everything the patients come into the hospital with. Step 14. Witness. Please make sure after completing the patient belongings form, the patient, guardian, or family member signs the form. If the patient is medicated and cannot sign, please write patient is unable to sign. Step 15. Witness, Part 2. Please make sure you write the valuable bag number, which you put in the patient valuable on the form. Step 16. Witness, Part 3. Once you complete the form and the patient or guardian signs, please make sure you sign the form and include your badge number. Step 17. Witness, Part 4. Once it is done, please notify the primary nurse or call security on 32500 or 713-873-2500 and tell them you need them for valuable pickup. Once the security checks and inspects the valuables, make sure they sign the witness signature and badge number 2 and include their badge number. Step 18, Witness, Part 4, continued. As soon as the bag is picked up by security, please make sure you keep the yellow carbon copy in the patient belongings bag. And document all patient belongings as written on the form in Epic. Also, the descriptions of belongings, who picked it up and where it is stored. Step 19, Retrieval. This is for when the patient gets discharged from the hospital and staff who goes with the patient or goes on behalf of the patient. Step 20, Valuables logged with security and date. This is for when the patient gets discharged from the hospital and staff who goes with the patient or goes on behalf of the patient. Step 21, Patient or patient representative signature. If you escort the patient to pick up the belongings, make sure the patient or their representative signs. Thanks for watching.